scary.
Yeah, I got super scared. I don't like sharks.
This is like me swimming up a bed.
Okay. And that's me from below, and I'm gonna.
So,
welcome back.
Not Jaws, the shark, but let's talk about Jawline.
Yeah, you have a beautiful jawline,
and
so do I.
Thank you.
How do we get that? Or how do we achieve a beautiful jawline?
How do you do it surgically?
Well, we're gonna jump to my surgery
You're staring
first.
me down over there. Let me put on my specs here.
Okay. Can I talk? So for the jaw, I'll just do it on me. So if you're coming to me, it's a little bit late. Why don't you start with yours? What do you like to do? If they've got a little puff here versus a little bit of jowling.
Yeah, so there's multiple things that we can do. It depends patient to patient, like I always say. So what I like to start with is a lot of times we have this bigger masseter muscle here, and it actually started from Asia, right? Where they started Botoxing the masseters to kind of shrink that muscle there, and then it gives a little bit more of a contour in the jawline. Sometimes I also will put, if we have the jowls down here, using Kybella, or little fatty pocket here, Kybella, and then putting some Kybella underneath for the double chin, and that really contours. And then sometimes there's patients that have a little indentation in their jaw right here, so we can put some filler there. Also putting filler in the chin looks beautiful, and then also right on the tip of the jawline, adding filler, and that helps out a little bit of a pull.
That's a lot of filler injections.
Yeah, but it makes you look beautiful.
Yeah, I think what she's pointing out, the goal, whether you're doing fillers, injections versus surgery, especially for the female payment, is the heart shape, the diamond. We want width here in the cheek, and then we want to kind of narrow this down. I think ethnicity has a large role. She mentioned in a lot of our Asian patients, like me, tend to have wide, lower face and anatomy, and our masseters are very wide here. That gives us a squarish look, and we want to triangulate that, right? And so slimming this here, and then she's talking about slimming this here with Kybella, and bringing up a good point. If we bring this forward, and whether it's Kybella or sometimes I'll do filler, right? Filler, Kybella, filler, and or doing a chin implant. That'll again kind of give that heart shape or that narrowness.
Upside down triangle.
The upside down triangle.
Yeah, so that's what we all want, is like the upside down triangle. As we start aging, everything that's here just starts to come down here, and we start to get the nasal folds and then the jowls. So our upside down triangle becomes a right side up, and we get all this down here. So to correct that would be all the things that we mentioned. And
so I like to do, for younger patients, what she does is great. Now when the jowls are really hanging here and then coming into the neck, then I basically will do a facelift or a lower face neck lift that'll essentially blend this whole area and really correct the jawline right here. And so that's what's real important down the road. If she can't correct with the fillers and injectables, then we're going to come to me, and I'm going to restore that jawline by a lift procedure. Am I pulling too tight?
Yes.
Because I feel my jowls.
Like
I think I might have to do it
everything.
myself here. But I don't need it yet, though.
No.
Right? Okay, thank you. And then so incisions are hidden in the crease. Heal time is generally 7 to 10 days for a face neck lift, so it's very, very quick and a really good, I'd say, bang for the buck in terms of. My goal is to restore with a lower face neck lift 10 to 12 years, 15 years rewind. So if you're 65, I want people to look at you and say, hey, are you 40?
Yes.
Is that right? No, I did the wrong math. 50?
Oh, you know what
15
I
years
do
back.
want you to talk about is when you do that surgery, I know right now you said hidden in the crease.
You want me to show you?
Well, because I've had multiple patients ask.
Oh, for a facelift? I'll show you right here. Come on and zoom in here. This is just how I like, and you guys have seen me do it. She's got the beautiful hair.
Wait,
and
that's not,
no. I was just gonna draw a happy face and a heart, but I like to go right in the temple, and it's real important to really make this irregular, so that it's not a curve, because people are drawn to lines. So you got to make it irregular, like the hair follicles. Then drop into the crease here behind the tragus, into the low. I mean, no one ever sees it.
Right.
It's nearly invisible. Then it comes behind and into the hairline, and
So
it heals so incredibly well.
Inside the ear.
Behind the tragus right here.
Okay.
Yeah. So, and we can, and sometimes people will ask me to do a little earlobe reduction, attach it more, super easy.
I actually had that.
A lot of
That was
tricks.
my favorite.
Which one? No, I
The
fixed your,
earlobe.
but that was for piercings.
Yeah.
Yeah, that's another
For the
topic.
earlobe.
Yeah.
We have to get into that next time because that's
Yeah.
a wonderful one. Everybody
So that's
loves
the
it.
jawline, right?
Yeah, jaws.
Dun it,
Bye.
dun it, dun it. Dun it, dun it, dun it.